So my name is Hsu Chong, and I'm a consultant in maternal and fetal medicine at the Rosie Maternity Hospital. I think that we have a very unique role as healthcare providers within the maternity service to convey very clear and specific information to women. One of the biggest things that have come out of the vaccination strategy when the Pfizer studies were first launched is that none of the studies were undertaken in pregnant women. The advice was really unclear from the College of Obstetricians and Gynecologists and also from the RCM, because we just didn't know about the vaccine safety. But we now have data points from over 200,000 women combined from both the United States and from the UK that shows that the vaccine is safe. From that, what I mean by safe from a healthcare professional to a pregnant woman has different meanings. So a pregnant woman wants to know, is this vaccine going to harm my baby? And the clear answer is it absolutely will not. There were a lot of fears about side effects from the AstraZeneca vaccine in the sense of developing blood clots in the head, and it was all over the tabloid press. But there's very clear evidence now from the non-pregnant population that catching COVID itself increases your chance of thrombosis far and above, beyond that the vaccine would ever cause. Catching COVID in pregnancy obviously has very serious complications. And there's now data from the systematic review that's ongoing and live in the BMJ that's constantly updated that shows if you do catch COVID, there's a potentially slightly higher chance of stillbirth. It's not still very well understood, and so that can be a very clear harm to the pregnancy if you catch COVID. And certainly for the women that have had the vaccination, none of them have experienced those very serious adverse pregnancy outcomes. The mRNA virus vaccine is not going to change your baby's genetics. It's got the very clear information that we're giving women. The AstraZeneca vaccine is not going to increase your risk of clots. And having vaccination during pregnancy is so very important. What we're hearing from women as well is about the women who've had vaccination before they were pregnant, when the Public Health England vaccination strategy started, became pregnant and then are now afraid to get the second vaccine. We're also getting a lot of queries about whether they should be having one vaccine versus the other. So if they've had the Pfizer vaccine to start off with, they are normally offered the Pfizer vaccine during pregnancy. But if they've had the AstraZeneca vaccine to start off with, then they are not sure about whether to have the Pfizer vaccine or the AstraZeneca vaccine. I think on the surface of it, the vaccination centers do not allow them to choose, but certainly the data shows that they should be having the same vaccine that they had the first time. So if you had the AstraZeneca vaccine, have the second AstraZeneca vaccine again. And there's no evidence that one should be mixing or mixing vaccines, and they provide the same level of protection. There is the subject of fertility, and there have been a lot of concerns recently about how vaccination may perhaps change menstrual cycles. And I think this is a truly reported finding. The information that we're getting through seems to suggest that vaccination may change or may delay the menstrual cycle of the next period, or it may bring forward the menstrual cycle. But there's certainly no, from a woman's perspective, no longer term harms when it comes to reproduction and fertility. So there's no evidence of that. We are also really encouraging women to have vaccination because the antibodies that their body generates, if they choose to breastfeed, will then pass through breast milk and offer their babies protection in that very, very vulnerable period of life. So we're trying to get the message across that vaccination should still continue for COVID during pregnancy, and women should not delay getting their second dose. You're absolutely right, Sunny, that women from the BAME ethnic populations are still very much experiencing hesitancy. I'm not quite sure how we can overcome that apart from just to continue the message that vaccination is absolutely safe during pregnancy and it protects the whole household. The data from the national surveillance within the UK would show that vaccinated pregnant women have never required hospitalization. And certainly when you've seen somebody in Papworth on ECMO who's pregnant or postnatal, who've not been vaccinated, it really does break your heart. I want to get my pom-poms out every time I hear somebody says they've been vaccinated in pregnancy. I just go, yes, well done you. Try your best to get out the message that you've had your vaccine in pregnancy and you're okay. Tell all your friends, because we've really seen devastating effects of COVID in pregnancy and beyond. And it's so heartbreaking to know, as you say, Sunny, that vaccination could really prevent the very, very serious side effects from COVID.